Off the top at noon, an effort underway right now to help those in a mental or behavioral health crisis get a faster and better way of transportation. State lawmakers considering the measure right now in Lansing. 13 on your side political reporter Josh Albertus live at the state capitol after hearing from lawmakers on those bills. Josh, good afternoon.
Yeah, good afternoon, Tanner. Yeah, when people are in these kinds of crises, as we heard this morning, they can really be left to wait for an ambulance or police. But what state lawmakers are proposing here is allowing state Medicaid to specifically cover specific behavioral health transportation, in their view, freeing up other emergency services to go elsewhere they may be more well equipped for, and to help these folks get more specific, targeted, and quicker relief in these situations. So someone would still have to be transported under these bills by an ambulance in certain situations, but outside of that, to make this kind of transport safer and quicker, they say, these bills would set up sort of a framework of coverage for specific, as I mentioned, behavioral health transport vehicles and how they would be regulated too. Things like vehicle safety standards, licensing, and training for people working at these transport agencies. Now, you may think that expanding Medicaid reimbursement to these transports would mean perhaps an added cost on a program that has already seen a lot of changes come down from the federal government over the past year. But given that some ambulance services can already get coverage and reimbursement through Medicaid, these state lawmakers believe that this could actually decrease costs.
But if we have this alternative option that's one less person, a less expensive vehicle, but can safely transport them, it'll be at a lesser cost. So my prediction would be we will see fewer costs as a result of this, because an ambulance trip is much, much more expensive than a singular vehicle with a singular person.
The program, and how are you confident to kind of explain that?
They say allowing this expanded coverage would also free up ambulances that are often used for this kind of transport to respond to other emergency medical needs, as I mentioned, and those that they are or may be more better suited for. So more details on what they are proposing in this legislation, we'll have that coming up later tonight. But for now, live in Lansing, Josh Albertus, 13 on your side.